Not everybody needs rotator cuff surgery who has a rotator cuff tear. Rehab can be very successful at times. The decision-making process factors in different things: the patient's age, the patient's activity level, the size of the tear, the chronicity of the tear, and what their expectations are.
So the treatment is a little bit different if we have a patient that has a subluxation, and again, a subluxation is if you just have partial instability. The ball comes partly out of the socket but not completely, and that's usually due to just stretching out of the tissues. We see that a lot in swimmers, people that do a lot of repetitive overhead activity, or if your tissue just isn't good. Some people are more lax than others, so they're going to have more motion. In those individuals with subluxation, non-operative treatment usually suffices, and they rarely need surgery. And we treat those individuals with physical therapy to strengthen the muscles around the shoulder, work on their posture. Sometimes they have to modify their activity as well, but over time they tend to tighten up and do okay without surgery.
We fix clavicle fractures when they create trouble for the patient. So not just pain, but if they cause trouble to the skin is in jeopardy, we would want to fix that fracture to protect the skin. If the fracture is in many, many pieces or very shortened, then we would want to have that fracture at a good length so that and that usually requires surgery to hold it at that good length. If you're a kid, and usually kid is considered somewhere under 15, most of those children will heal their fracture without difficulty, and they don't normally require surgery. The rest of us adults have a choice. Most times, their fracture can be in a place where that creates a fair amount of pain. They may lose time at work. They may lose time in their sport. And so surgery is required or offered to get them back to their sport, get them back to their job, get them feeling more comfortable